Okay, let's go over these cases where you are in a state of volume depletion, euvolemia, or volume overload. And the way you can determine which one you're in is first by looking at your uosm and then by looking at the urinary sodium. So first of all, if your urine osmolarity is greater than 100, that means you have circulating ADH. So in these three cases we're going to talk about, we have ADH circulating, which means that you're going to have some water retention by your kidneys. So let's look at volume depletion and volume overload first. So in volume depletion, you'll notice that your urinary sodium is less than 25. And this should make sense because if you're volume depleted, you want to try to reabsorb as much sodium as you can because in the body, sodium equals volume, right? If you reabsorb sodium, then you can reabsorb water and then you can try to correct this volume depletion. So your urinary sodium is going to be less than 25. It'll be a little bit lower than what we might see in euvolemia. Now, similarly, if we look at volume overload, you're going to see that your urinary sodium is going to be low. And in this case, you might be thinking, well, how does that make any sense? If you have a lot of volume, why would you want to be retaining sodium? Wouldn't you want to be excreting sodium if sodium equals volume? Well, in this case, a lot of these volume overload cases are instances like congestive heart failure, where even though your body has a lot of volume, the kidneys perceive that you're in a hypovolemic state because your heart is failing. And so your heart isn't pushing out that much volume. And if your kidneys aren't receiving that much volume, they're assuming that the whole body is in a hypovolemic state. So it's a perceived hypovolemia, even though in reality you are, it's a perceived hypovolemia, even though in reality you are hypervolemic or volume overloaded. So what your kidneys do? Well, they think that you don't have a lot of volume, even though you do, because you haven't something like congestive heart failure where you're not pushing out a lot of volume to your kidneys. So what your kidneys will do is they'll be like, okay, we need to reabsorb more sodium. So your urinary sodium in this case will also be low or less than 25. Now let's look at euvolemia. So why would you have euvolemia in instances like SIADH or syndrome of inappropriate ADH secretion? So in this case, what's happening is there's nothing wrong with your body. For some reason, the only thing that's wrong is that your body's producing a lot of ADH, and ADH is going to retain a whole bunch of water. So what does that mean? That means that you're not going to be in a volume depleted or volume overloaded state. You're just retaining a lot of water. And if you're retaining a lot of water, your body's thinking, wait, we have enough water. Why do I need to conserve sodium? I don't need to reabsorb sodium if sodium equals volume, right? So what's going to happen is that your urine is then going to have a lot of sodium in it because your body is seeing that your ADH is conserving a lot of water already. Why do you also need to conserve a lot of sodium? So you're going to start having a very high sodium concentration because you are not going to be reabsorbing that sodium. But another way you can think of it is that you're just reabsorbing so much water with this ADH that this is becoming, your urine is going more concentrated with sodium because you're absorbing so much water. But it's also important to remember that in euvolemia, you do have a balance between your ADH, so you start reabsorbing a lot of water, and then you also are going to have inhibition of the renin-angiotensin-aldosterone system as well to preserve this euvolemia. Because if you are going to inhibit the renin-angiotensin-aldosterone system, you're going to inhibit aldosterone, and aldosterone is something that is going to usually encourage the absorption of sodium. So if you're inhibiting aldosterone, then you are not reabsorbing that sodium, and you're going to be in a euvolemic state in this instance. So hopefully that makes a little bit of sense as to why the sodium cases are the way they are.